for starters. And we've talked to Governor Brown personally, and he has assured us that he says the government, or the budget process is like a 52 deck of cards. He controls 51 of the 52 cards. And he has committed to us, the sheriffs and chiefs in this state, that he will see this through. And he's been a man of his word, I will say. And that he, on SB 1022, they wanted to reduce that. He stuck with it. He's sticking with this as well. I understand Nancy Skinner doesn't want this project. She also tried to stop the BSCC process from moving forward. It was not successful at that. But as I've said publicly and in the press, she's moving the goalpost after all the counties have applied for the funding. And that doesn't work. And certainly the administration and Diane Cummings, and for those of you who know the governor's staff, I think at the end of the day, that money will remain in. So I think we'll be fine.
Yeah, I will. And then, it's Brody, I have one mental health for Jill, and then I'll open it up for Jill.
People are leaving because they aren't getting a chance to say, let's hear about mental health.
Okay. So Jill, the question they had is in regards to the Mental Health Commission report that 10 mental health clinics here in Contra Costa County are understaffed, and it typically takes 2 to 4 months before patients can actually get an evaluation or treatment. And there's roughly 900 people seeking treatment each month, almost double the number since 2010, yet there is no efforts from the County Board of Supervisors to increase staffing. How does Supervisor Candace Andersen say in good faith that there's already enough services being provided in Cocoa County?
I don't think that statement was made that there's enough services. We're always looking to identify gaps and determine how to fill those gaps. We're always looking for more funding. We apply for grants all the time. We have a Prop 47 grant in right now, which is the first time Prop 47 monies were actually, Prop 47 passed a couple years ago, but then the money trail took 2 years, and this is supposed to be the in-community programming that we use to address that population. So we have that grant application, and fingers crossed we get it. As far as mental health facilities go, we have an amazing challenge in finding psychiatrists, and it's a nationwide challenge. And we are currently negotiating with our physicians and our psychiatrists union to try and come up with a solution and to do a pay equity study and determine how do we get more psychiatrists. And we were coming up with some very creative ways. So that's part of the problem with the services. It's not that we don't have facilities. And just to clarify, Doctors Hospital that was in West County was not a county hospital. That has been repeated over and over again. It was a hospital run by the West County Healthcare District, which was supported by private tax funds to the community. They attempted to reorganize their facility to make it a profitable effort. It didn't work. The county loaned them in excess of $20 million to keep it floating while they tried to reorganize it. It didn't work, and they still owe the county $20 million out of that West County Healthcare District. We did not close the hospital. The independent board that runs that healthcare district did. We do, however, have a county hospital in Martinez, and we have 9 healthcare clinics throughout Contra Costa County. We have 2 in West County. We are currently expanding our West County Healthcare Clinic. We're currently in the process of developing a plan to expand our Concord Healthcare Clinic, and we are about to do the groundbreaking on our Brentwood Healthcare Clinic. So we are expanding services. It just takes time. Affordable Health Care Act. One of the things I was going to say before that I didn't have time was advocate to your state and federal elected officials. Affordable Care Act, if that goes away, we are going to be devastated in our healthcare system in Contra Costa County. Our directors of our departments are having conversations at the state and federal level to try and figure out how to solve this problem. But these things are devastating and they're out of our control, and unfortunately, the county is left and everybody turns to us and says, how are you going to solve this? How are we going to solve $50 million loss from our healthcare system?
Thank you. With that, I'm going to open it up, and what we'll do is I'll have you raise your hand and we'll bring a mic over to you.